Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today we are joined by Mark Cohen with ProCare RX. He is the VP of Sales and Marketing. And Mark, I'm so glad to have you on the show.
Glad to be here, Sally. Thanks for the opportunity to talk about what we've got.
Absolutely. Well, let's jump in. Tell the audience who ProCare RX is.
Sure. So basically, ProCare RX, we're a privately held firm. We're a leader in technology-enabled pharmacy services. And we really focus on pharmacy claims, PBM services, clinical programs, formulary design, those types of things. We're based here in the U.S. We have offices around the country. And we really create customizable, cost-effective plans for a variety of groups. It could be anything from self-insured employer groups, TPAs, pharmacies, health plans, health systems, hospital programs. We do a lot with unions, work with industry leaders. We're a committed partner. Our whole objective is to optimize pharmacy benefits and clinical performance.
And I know you and I have spent some time together. I've heard you talk about the EDGE program. Can you explain a little bit about what that is and how it sets you apart?
Absolutely. So the EDGE program is a rebranded, refocused program that we offer. It's a ProCare RX program, but we also offer it through our EHIM powered by ProCare RX brand. And what this does is this really balances cost savings and clinical efficacy. And this is really important because, there's really only two things that you can change when it comes to a pharmacy purchase. And that is you can change the drug or you can change where and how you purchase the drug. So the two components of the EDGE program really address those two factors.
And I know hearing you talk in other public events and arenas, you talk a lot about transparency. Is that an important component to the EDGE program?
So, when you look at a PBM, we get a lot of bad press. All PBMs get a lot of bad press for a number of reasons. And one of the things is the most overused word is transparency. And what we did here, and this is something that we've been doing since we were founded in 1988, is we offer what we call clear site transparency. And clear site transparency really is a clear, direct look at the data, pricing, claims cost. The client owns the data. So it's not that there's something that we ever try to hide. They have full access. We give them the tools, we give them the technology. They can see everything. We've got reporting tools. They can create customizable, data-driven reports. And I think that that's important. They've got full ad hoc capabilities with our tools to go in and look at their data, get whatever insight they need, and it's right at their fingertips. We also have pre-built library of reports. So, if somebody wants to customize, great. If they just want pre-built, we've got that as well. And what's nice about it is they see everything on a monthly basis or a real-time basis. Ingredient cost, admin fees, what we pay the pharmacy. So it's full transparency, full pass-through, full everything.
So that's a huge differentiator from the big players in the pharmacy space, is having access to that data. But I think in today's environment, people scrutinizing their drug spend, data is just part of it. How are you all addressing cost?
So everything that we do is based on lowest net cost. There's a lot of things going on in the industry and in the marketplace, but when push comes to shove, it's lowest net cost and the clinical efficacy of your plan design. So with the ProCare RX Edge, we have basically two subsets, and underneath each of those, there's some components. So the first piece we call Saving Edge. And what Saving Edge does is it really delivers a multifaceted approach to secure savings on high-cost medications. Because let's face it, there are a lot of high-cost medications out there. This is an enhanced and rebranded program. And what's great about it is there are different ways for a plan sponsor or a patient to get the right drugs that they need. And we do that through a number of components. One is called Smart Copay. And what this really does is it lowers the cost to both the patient as well as the plan sponsor. We can set different copay tiers. We've got Smart Delivery. Smart Delivery is how you get the drugs. Personal importation of medicine through an international program. It's a mail order refill program. We've got a domestic program for both brand drugs as well as generics. And these are refill only, home delivery, some cases prepaid programs. We also have traditional mail order. And, we can affiliate with any mail order pharmacy that the plan sponsor chooses to affiliate with. And then we have got smart exclusions. And what this is, this allows the plan sponsor to create a formulary and make adjustments so they can eliminate coverage for certain drugs, add certain drugs, do whatever that takes. And that's really important because if you put those pieces into play, you now have been able to get the right drug, you're able to deliver it in the most effective manner, and save a tremendous amount of cost. And we've seen a wide fluctuation. With this program, we're projecting right now, based on what our clients are seeing, anywhere from a 20 to 60% savings.
Wow. Those are significant dollars.
And we'll back it up because you have the data. ClearSight Transparency gives you the data, the reporting. You see everything.
Absolutely. Kind of talking about data and cost, I know you all really do a great job of balancing the clinical side and cost savings. Anything else you want to share on that front?
Absolutely. So the other component of the ProCare Rx Edge program is called Clinical Edge. And what Clinical Edge is, this is where we get our experts and our clinical pharmacists and our team involved. And this is formulary option design, drug management tools, medication management and adherence programs, point of care therapeutic substitutions, education and engagement. This is where we bring in and show biosimilar options. I've got a great case study on the Humira drug class biosimilar savings that some of our clients have seen. So there's lots of different options. This is not a one size fits all program. We'll go in, we'll sit with our implementation teams and our account management teams, and we'll talk to the client and we'll understand what they're really looking for. We'll assess their data. We'll assess their claims and we'll look to see where can we get the best savings for both the plan sponsor and the patient. Because ultimately, at the end of the day, if we don't deliver the lowest net cost to the patient, we're not helping.
So I want to make sure I understand that. So you bring in an actual pharmacist.
We have clinical pharmacists on staff who will sit and work with the accounts.
Okay, so one-on-one with the head of HR, the employer, whoever is leading the efforts to talk through what makes sense. So what I hear you saying is, no offense to sales folks, they're wonderful and necessary, but it's not just a salesperson putting the plan together. It's also a pharmacist sitting alongside.
No. So what happens is, once we get through the sales process, we bring in our industry leading implementation team, our account management team. We've got an entire division that just does clinical. So we've got clinical pharmacists, we've got experts on formulary design, we've got a variety of different subject matter experts who come in and work with each client. And this is important because if they don't do that, then it's just cookie cutter. And I can tell you, we are definitely not cookie cutter.
So I want to go back to, you talked a little bit about technology, being a technology driven firm. Can we dig into that a little bit deeper? What does that mean for ProCare RX?
Well, we own our own claims processing network, and that's really important because we're one of the only PBMs that actually does. And that's very important because it makes us flexible. We can make changes quickly. There have been some major breaches out in the industry that caused a lot of aggravation where networks were shut down, people couldn't get their pharmaceuticals. It affected my family. My daughter went to go get something that she was working on a copay program, and the pharmacy couldn't fill it because they couldn't send the transaction to the processor. We own our own adjudication, so we can actually make on the fly changes. We've got redundancies, we've got backups. So that's the core of your network processing technology side. And these are options that clients can choose to use. On the flip side, we've got reporting. So we've got a number of reporting tools. Zero In is a good example. ProCare is another example. We've got member apps, so you can go online and look at everything. We've got a cell phone application that can be white labeled and custom branded. So a patient can go in and they can look to see what's the drug, where are the pharmacies that are in my network that are local that I can find. We can look at any claims. We can look at any detail about the drug. We can look at cost to make sure we're getting the lowest cost. There's prices out there, but you can't always guarantee that if every pharmacy you go to, it's going to be exactly the same cost. And that's completely out of our control. I mean, we've all seen it. You fill a prescription today and you fill a prescription next month at a different or even sometimes the same pharmacy, and there's fluctuation in the cost. Not dramatic, but there's still some fluctuation.
Sure. But what I hear you saying is that, especially with the app that is member facing down to the employee or plan member level, you're literally allowing them to, on their own, look for the best cost. Is that month by month? I mean, can it, talking about those fluctuations, it's a shopping tool, correct?
It's more of an analysis tool. It's a data tool. So we're pulling information down from various sources. It is not, let's go shop the different pharmacies.
Okay.
That's functionality that, yes, I'm sure that we'll get to. But for right now, the mobile app itself has a number of different icons and areas that you can touch on that gives you an understanding of your prescription, what it is, all the details. You can look at claim history. You can look at a lot of different things. A lot of our clients use it for a number of reasons, but one of the key ones right now is, where's the closest pharmacy?
Mm-hmm.
So the pharmacy finder is a great tool. A lot of organizations have it. You can find it out there, but having it all right here on my cell phone
It's necessary right now.
saves me time.
Yeah, that's how everybody spends their time. So, what's next for ProCare RX? What are you working on that you can share with the team?
Well, we're looking at a lot of different new programs, clinical dashboards, more insight. Everything we're doing is, again, around transparency, clinical, and lowest net cost. So as long as we work on programs that help our members, our plan sponsors, our clients, the patients be able to do those things and get the most effective drug at the lowest net cost to hopefully allow them to get their medications, be adherent with their medications, that actually has a downstream effect or an upstream effect to the overall health and cost of healthcare nationwide.
Absolutely.
I mean, if you take your medicines and you don't have to go to the emergency room or go see the doctor or end up in the hospital, guess what? The drug portion, the pharmacy portion has saved you and saved the healthcare network a lot of money.
Mhm.
And we've seen it. We've seen it over and over. You've probably seen it personally. Everyone listening's probably seen it personally.
Mhm. So, I also want to circle back to what your client makeup is. You mentioned a wide range, but do you have a couple of areas of focus?
Yeah, so basically, self-insured is our number one. We sell through broker channels. We also sell direct, but we always keep the broker involved in the process. We also go after health plans and health systems, 340B programs and other types of ways that hospitals and health systems can utilize their own pharmacies, their own employees, and have an employer program. We're not a 340B provider, but we have 340B partners that we work with. Those are your primary target audiences. I mean, yes, we'll go after self-employed. We'll go after unions, school districts, municipalities, and government, because they all have self-employed or self-insured components and are all looking for the lowest net cost, the easiest thing for their patients, and ways to save money. Because if they can save money and pass that down, that helps us all the way around. And, I look at it from the municipal perspective. I'm a retired 20-year public servant. I held elected office. I had employees. I watched as we went through and had to look at the different drug spend. And if there was ways to cut it, that only benefits the patients, the cities, the municipalities, the taxpayers when it really comes down to it.
Well, I think that's a perfect note to end the show on. Mark, do you mind telling the audience if they want to learn more? Obviously, we're proud partners of you guys for the Granite List, but if they want to dig a little bit deeper into ProCare RX, where should they go?
So you can go to our corporate website, which is www.procarerx.com. And from there, you can get a little bit of insight. You can also look at our affiliated brands. So we talked a lot about EHIM powered by ProCare RX, which is focused primarily on the broker channel, the self-insured broker channel. ProCare RX offers the same tools and solutions, but we're aimed a little bit more at the enterprise, aimed at health plans and health systems. But when you come in and you purchase solutions or utilize solutions from any of our brands, you're getting the ProCare RX Edge advantage.
Absolutely. All right. Well, thank you for joining us. This has been a great episode, informational episode of the Granite List Live. And thank you to our audience for tuning in.
It's been my pleasure. Thanks, Allie. Thanks, everybody.
Thank you, Mark.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.